Now, for a patient having kidney disease, it's very, very nice that you always try to examine what the size of his the flanks, you could say what the hips, around the hips coming up to the stomach level. So it's always good that you actually examine there. And when you examine there, you try to ballot the kidney, try to palpate. You see that there's always pain. Okay, so that's one of the signs that you can now use to now confirm that there's a kidney disease. Okay, so there's pain in the flanks. So flanks, you have the right and the left. Okay, so you should know that what is a common presenting symptom. In fact, if you see a patient that you are suspecting that has a kidney issue and you don't get to check if there's pain in the flanks, it's like a sin. Okay, so causes of abdominal or flank pains in kidney disease is, for it could be that the patient has what polycystic kidney disease, the cyst. Okay, they stretch the capsule and they cause pain, which is usually dull. Okay, hydronephrosis rather. Uh, there could there could be like there could be like obstructions. So the pain is usually colicky, and this mimics renal colic pain. Okay, so that's what we got. So there's pains in the flanks. It could also be that it is pyelonephritis. Okay, so pyelonephritis is usually, I think it's usually inflammation as a result of infections. So you also have that. So costovertebral angle tenderness is a classic sign. There could be renal calculi, so renal stones. So the pain is usually sharp, it's colicky. You know, patients are usually restless, unable to stay still. Okay, they may also have hematuria. Okay, then it could be renal tumors, pain due to mass effect or hemorrhage. It could be acquired cystic kidney disease, like you have had dialysis for too long, and your kidneys are overstressed. Do you understand? And it may result from cyst enlargement, result from hemorrhage, and the kidneys are also vulnerable to infections. So the physical examination is always you locate the flanks or the upper abdomen, then you try to kind of like do some palpations and all of that. So if there's so much tenderness, you're suspecting that maybe there's infection, hemorrhage, or obstruction. The palpable mass, okay, then you know and all of that. Then ballotability, if your kidney is smooth, enlarged, okay, you can ballot the kidneys. Of course, you know that there's a swelling, okay, and definitely that's deviating from the normal size of the kidneys.